More fatalities are expected in different parts of the world. 213 countries are affected. These numbers have increased as the pandemic continues to spread. There are claims that this deadly virus escaped from a laboratory in China in the province of Wuhan. There is no real evidence on how the virus emerged. Now the virus has spread around the world through people who got infected by other people who had it. South Africa is affected by the pandemic coronavirus. Minister Dr. Zweli Mkhize visited hospitals in the Eastern Cape and many other hospitals around the country. Mobile clinics are playing a major role in combating the spread of COVID-19. The delivery of food parcels and relief schemes were indicated. We also look at other interventions. In this episode, we look at how the South African government responded to curb the spread of COVID-19.
Insisted now that there should be rapid action. Part of what the challenges was with the province is that there were certain delays in the supplies of protective equipment, mainly because of the shortages that are being experienced. So we've now got the National Department team to go into its own processes to actually get stock out. They should be off the stock that's been delivered recently so that we can quickly replenish the stocks. The head of department is going to go into the database and between today and tomorrow round up and call as many people as possible to fill up the vacancies where we need particularly professional nurses to augment the hospital staff and the tracing teams, and that is going to be taking place as of now, as we end this meeting now.
Minister Dr. Zweli Mkhize visited a day after the province recorded its first COVID-19 related death. The minister met with staff at the Rob Ferreira Hospital to check on the readiness of the hospital to deal with COVID-19. The minister said he wanted to make sure that everyone who visited the hospital for treatment gets the best possible care. That was the main reason for his visit to the hospital. The doctors and nurses at the Rob Ferreira Hospital are highly experienced. We discussed their challenges and we are going to address them. That's what the minister said. Minister Mkhize has received ventilators from the US government. Candles were also lit in solidarity for frontline workers. Before the handover at Chris Hani Baragwanath Hospital by the US Ambassador to South Africa, Lana Marks, the US government pledged 1,000 ventilators. 20 have been installed at the historic hospital. The hospital is a historic monument. It is one of the epicenters of clinical excellence in the country, said the minister. Thank you for this contribution of arming our forces.
This is one of the many visits that we're going to be doing. Last week we started off in Tshwane district where we went to see a hospital that we have decanted, which is now dedicated to COVID-19. And we also went to Kalafong. It's just to see all the facilities that we are preparing for them to be able to deal with the COVID-19. So this is also one of those part of the visits. Here we are hoping to start off with 500 beds, which are going to deal with both the quarantine patients and isolation patients. We're going to phase it in as we go to build up to a point where it can be able to carry more than 2,000 patients. At the moment, we are building capacity in our hospitals for those who will require to be admitted and require medical attention.
As the NHLS, we've got two types of vehicles. We've got what we refer to as a screening and swabbing vehicle, and then we've got a vehicle that can screen, swab and test. The plan for the vehicles is to ensure that we can go into communities, into hard to reach communities, and we place the vehicle outside, and we've got our dedicated team that goes and swabs and screens all the patients. Every mobile has a team. The team consists of a driver and 2 nurses. One nurse is dedicated to take all the patient details, contact tracing, and the other nurse does the swabbing. We have at least 1 mobile that will be fully functional in every district, and we have, in terms of hotspots like Gauteng and KZN, we have allocated more vehicles in Gauteng as opposed to Mpumalanga.
Being on quarantine site is not an easy thing. No one wants to be away from their comfort zone. So our contribution here is, I feel it is very important that we ensure that we at least make it a bit easier for the persons under investigation to get at least a decent meal, a balanced diet, and food that looks good.
My role here is to ensure that our employees are protected in terms of OHS Act, which is Health and Safety Act, and I'm also here to ensure that the food that we serve is safe for the consumer in terms of the Act 54 of 1972. In terms of upping the game, we have changed our procedures in terms of reporting to work. So our staff members, when they report to work in the morning, we make sure that we screen them. We've got the infrared body temp thermometers where we check their temperatures in the morning, and then we do visual inspection, and then if we find one to be sickly, then they will have to be taken to the doctor for further investigations.
If not us, who else? You know, doctors are doing their role, the military is doing its role, I'm doing my role as well, proudly so. We love what we do, and we're very proud to be contributing as well to South Africa in the fight against this COVID-19.
We went to Alexandra to interview the workers at Alex FM and recipients of food parcels.
If I'm not working, I do not have anything to buy for my family, something to eat.
We are announcing this evening a massive social and economic support package of 500 billion rand.
I mean, I was called by SASSA through LSFM, waiting is able to go for percent. Then I came, now I told her.
Alex FM was working together with SASSA to distribute food parcels. The local radio station assisted people who had no airtime to complete their cell phone registrations to ensure that those in dire need received their food parcels. The people of Alex were very grateful for the assistance during the great battle with COVID-19. We had to mute the audio in this interview due to disturbing background noise.
Re le tshebeletso ya Alex FM re ile ra ba le dipuisano tse ntle le bona mo teng re ne re thusa ka hore re fumane list ya di members tsa community on air. Batho ba founa, motho ana le bothata founa a kopa food parcel, re ba ngodisa re nehela SASSA, ene SASSA ene e potlaka ka pele ka potlako ka mokgwa le tsela e leng gore ba sebedise ka teng ke bona re thusitse batho ba bangata la ile mona go sa tsena hona le ba bang gape ba bangata ba ile gore ha ba so di fumane but go fihlela ha kana well hanyane re ntse re ya pele ke bona re sebeditse hantle haholo ho feta le ka mokgwa re lebeletse.
My name is Takalani Nemangue. I'm the station manager of Alex FM. Well, the COVID period caught all of us off guard, but I must say that our government has, tried their level best to respond to this pandemic, and we have seen it because we are in the space as a community media and we are in touch with the people. We've been very much involved on issues of distributing food parcels to our community. We've been, in the forefront in making sure that we disseminate the government messaging through our platform, which is the radio. And the government has been very much effective in making sure that whatever that the community needed to know or needs to know during this period is made available, and we are able to utilize our platform to disseminate it.
The government introduced the COVID-19 Financial Relief Scheme when the lockdown began. These funds were allocated to temporarily assist unemployed people, workers who could not work because of the virus, and some businesses.
This is a matter of survival, and we dare not fail. I know we shall recover, and I also know that we shall overcome. May God bless South Africa and protect her people. I thank you.